Hi, and welcome to the Neuroscience Virtual Event 2017. My name is Dr. Campa, and I will talk about my research here in Mexico. The title is Optimal Cut Point for Cholesterolemia to Predict the Occurrence of Hemorrhagic Cerebrovascular Event in patients 18 to 60 years of age who received care in a second-level hospital of the Mexican Institute of Social Security in the state of Sonora. So as a background, we're going to talk about cerebrovascular diseases in general. And one of the things is about the background. So cerebrovascular disease is an important public health problem, as you know, and second is the second global cause of death. 4.9 million cases occur in middle-income countries, and 1.2 million presents in low-income nations. By 2030, its incidence will increase by 44%. So according to the latest data presented by Mexico's Secretary of Health, showing our country, the mortality rate of cerebrovascular disease has continued to increase since 2000, particularly in people below the age of 65. During 2007, from the total income in public hospitals, 1% was attributed to cerebrovascular disease. In the northern state of Sonora, during 2008, there were 709 deaths due to cerebrovascular disease complications. So as you may see, Sonora is one of the states of the country with the highest mortality rate, with an incidence of 28.5 per 100,000 inhabitants, a figure above the national average because of its pathology. So the purpose of our study was to establish an optimal cut point for cholesterolemia to predict the occurrence of hemorrhagic cerebrovascular event in patients 18 to 60 years of age. The method that we used actually was to assess cholesterol levels in 50 cerebrovascular disease patients, hemorrhagic and ischemic, that were admitted at the emergency department in General Hospital number 14 of the Mexican Institute of Social Security. We determined whether the cholesterol levels in these cerebrovascular disease patients were less than 180 milligrams per deciliter, as we previously checked some articles from Japan in which they were looking for cardiovascular diseases, but they found additionally that in the Japan of the pre-war era, the diet was low in fats, and they have a lot of cases of cerebrovascular diseases, especially hemorrhagic. And when they were conquered and after the war and they reconstructed Japan, the diet became westernized. So they increased the cardiovascular diseases, infarcts, heart attacks, and actually they saw that the incidence of hemorrhagic cerebrovascular diseases lower after all those years. So they were looking for heart attacks, so they merely seen this just as a little observation, and they didn't study it further. So here we're trying to make a study that follows that line that they just observed, but we're trying to do something better. We're trying to make assumptions, especially if there's a point in which there's a predisposition to hemorrhagic cerebrovascular disease. For biostatistical purposes, we use the IBM, SPSS statistics, and MathCalc software. So as you can imagine, the results that we had, the rock curve analysis of the cholesterol levels as predictors for hemorrhagic cerebrovascular disease, found an area under the curve of 0.77 with a confidence interval of 95%. Our Juden index was 0.68 with a confidence interval of 95%, determining an optimal cut point value of less or equal 161 milligrams per deciliter. So the confidence interval was 95% with a level of serum cholesterol between 149 and 161. A cutoff point set at less than 161 milligrams per deciliter determines a sensitivity and specificity of 84 with a confidence interval of 95%. So as you can see in the next graphics, the rock curve, which actually show us the cholesterolemia and the incidence of hemorrhagic cerebrovascular disease, especially in the terms of sensitivity and specificity. So you can see it all combines at the 84%. So the next graph shows a comparison between the hemorrhagic cerebrovascular disease, which is line in blue, color in blue, versus the ischemic cerebrovascular disease, which is in red. And actually, you can see how the cholesterol levels reach a point in which, for the hemorrhagic cerebrovascular disease, we find a cutoff point of 161. And for cholesterol, it goes higher than 200. So as you can see, the area under the curve is 0.77, and the P is very significant. Has a very high significance because it's less than 0.001. So the cutoff point value of the serum cholesterol, as you can see, for the hemorrhagic cerebrovascular type is 161, and for ischemic cerebrovascular disease, it's actually around 180 to 200 and more, higher. So in conclusion, in a patient with a cerebrovascular disease, our study shows that a cholesterol level less than 161 milligrams per deciliter is able to determine the presence of hemorrhagic cerebrovascular disease with high levels of sensitivity and specificity. So we propose that in scenarios with resources that are limited and the completion of a definite imaging study may be delayed, cholesterol levels should be used as a supporting diagnostic test. Our study is a pioneer in implementation in the Mexican population and the American continent. So the better understanding of this nature of disease is actually very encouraging for future generations and future research, so we can understand the disease and make, in the future, better medical interventions to avoid mortality and disability. Thank you for your attention.